What's happening? I'm Rashad Richard, local radio and TV personality. Before I get into talking about my friend Dr. Carhi, let me say I am a believer in chiropractic. A few months ago, true story, a few months ago, I was playing in a celebrity basketball game. I came up, went for a layup, came back down, injured my back. Now I'm trying to still play in this celebrity basketball game, thinking it was probably a muscle issue, and I had to check out of that game. I left the game in excruciating pain, went home. When I went home, went to sleep immediately. I was in so much pain, it was unbelievable. Never had a back injury in my life. Woke up at about 2 o'clock in the morning. 2 o'clock in the morning, I try to go to the restroom. I can't use my legs. Can't use them. I went back to sleep, really terrified. Woke up again at about 6 o'clock in the morning. And I called my friend Dr. Carhi. And Dr. Carhi could hear the pain in my voice. This brother made a house call, worked on my back, and even though I still had pain, I could walk. He scheduled me to come into his office. I did an x-ray. Come to find out, I had something pretty major. You got a technical term for what I had. What was going on with my back?
Anterior spondylolisthesis.
All right, now what is that again?
Slip bone. It was pretty bad too.
It was bad. And when I looked at the x-ray, I was shocked that I could even walk. And what I did, if you remember, I still went to work that Monday. And I sat down at the radio station, did my show in all of this pain, and I'm still thinking, it's not that big a deal. I'm just in a lot of pain. It'll go away. And Doc, it was just getting worse. And then when I came to you, we did the x-ray. We had a decision to make.
Yes, we did.
And the decision was, do I do surgery or do I undergo intensive treatment from you? Your team made the decision, let's do intensive treatment through the chiropractic clinic.
Yes.
And that's what we did. And man, I play basketball every week now. And so when I tell you chiropractic changed my life, that's 100. And so after Dr. Carhi took care of me in that way, I said, anything you need, man, I'm going to make sure people know about what you do and how great you and your team are at doing it. Yeah. So, I mean, what's the background to that? Why was that so effective?
Well, chiropractic care is a unique type of modality that utilizes non-drug approaches to move vertebrae and alleviate pain naturally. The movement that we put into your spine in your case was a very delicate one because the nervous system is very close to the vertebral spinal column. So I had to use a technique that was very specific. So a lot of practitioners may have missed it, but I was able to identify it and educate you as to the seriousness of the situation and then provide you therapies that were effective in alleviating your symptoms. And this is all done naturally without the use of drugs and thank goodness without the use of surgery.
Amen to that. And man, I have not had any issues with my back whatsoever. All right, I can get on the basketball court. I feel like Jordan in his heyday.
Yeah.
Okay, and I know when I went through it, I was feeling like, man, this will never get better. That's how bad the pain was. And so, brother, I want to say thank you from my heart. All right, we got a lot to talk about. Let's talk about people who are injured and they come to a chiropractor and they have to document the injury so that they can receive the benefits they deserve. What is that process?
Well, it's a very intricate process and something that needs to be handled by a professional who has knowledge of how to build a case. So when you come to them, you make sure that your physician will be your advocate. But there are 5 major financial drivers that if the provider is not knowledgeable, that they'll miss it. Number 1, you have to detail the list of injuries. And the most commonly missed injury in most of these cases are going to be what they call a soft tissue injuries, meaning that you don't have a broken bone, meaning that it may be what they call a low impact injury. But there is still real possibility of damage. And the damage we're talking about is ligament damage. And ligament damage can be proven objectively. And one thing that's missed by most practitioners that are not careful or not knowledgeable is going to be alteration of motion segment integrity. Okay, that's when you have ligament damage that is identifiable and proven on x-ray. So I am skilled in understanding how to take pre and post x-rays, and we can measure the gapping of your vertebra, and we can show definitively, objectively, there is an alteration of motion segment integrity. Number two, the thing that most people have 30% of the time is going to be a disc injury. Most commonly, the practitioner will order an MRI, and MRIs will show disc bulges, and disc bulges are proof that you have ligament damage and a bulge in your dense connective tissue. And that's what my team often does in cases of motor vehicle collisions. And then if you have a disc and a ligament that's injured, you remember I told you your nervous system is very close to your spine.
Right.
Next is going to be the nerve injury. So then you have peripheral nerve damage, and it travels down from their cervical spine down their upper extremities, or most commonly know about sciatica. And that's where it goes from their lower lumbar spine down their lower extremities to their feet or their toe. That can be proven, and it can be detected clinically if you have a skilled practitioner and they're looking out for the best interest of their patient. And then they have something that occurs more often than not. I mean, is more aware of it now, but it's only in 10% of the cases. And that is the mild traumatic brain injury or the concussion. And you can have concussion without loss of consciousness. And the practitioner needs to identify this and bring this out in the questioning of a patient. If they do that, then they can identify it, they can document it, and it does add value to the cases. So then you talk about the maximum medical improvement, and you talk about an impairment rating. This means that you finish treating the individual, they're as good as they're going to get. They're finished healing, but then you still have a permanent impairment. That means they had ligament damage where they had anatomical failure, and now it needs to be identified, and you have to diagnose it. Now, the only person who can really diagnose it is the practitioner. The treatment that we're going to use is going to have to be based on science. That's treatment we use in our offices. Right? Every tissue in your body heals in 3 phases. It's first going to go through the inflammation phase. That's when it gets hot, it's swollen, and then it's going to go through the repair phase. This is key on whether you're going to heal right or heal wrong. That's where your body lays down type 3 collagen. And type 3 collagen is less elastic than regular type 1 collagen. So the practitioner needs to understand and know this. This is why individuals do not heal properly, because they don't get the proper therapy or they don't get the proper treatment during this phase. And chiropractic is excellent during this phase. As a matter of fact, we stretch the body's tissue in the joint motion. Now there's 3 ranges of motion. Number 1 is active range of motion. That's where your muscles can move your joints through a range of motion. Then number 2, there's a passive range of motion. That's where the practitioner can guide the joint past where your muscle can guide it. And then it gets to the point where you get a little resistance. Well, that resistance you're feeling, that's ligament, right? And that's your joint motion. Very important. That's where your repair tissue is doing most of the repair. So guess what? If you have a therapy that's not going to go to joint motion, you're going to miss about 70% of your repair of the joint. And guess what? The chiropractic alignment, the treatment is given in the joint space. That's why we're so effective at helping individuals when they're in this repair stage of healing. And this is important to your therapy protocol to make sure you're getting this repair. Because if you do not, then you will heal improperly. And that means you'll heal with permanent restrictions. And if you heal with permanent restrictions, guess what? Those adhesions can lead to permanent impairment, especially when you have forces that are given in the accident that can tear ligaments. And that's where we come into play. We can document this happens, we can see and order the proper testing, and make sure your documentation is showing without a shadow of doubt that you do have this permanent impairment. And that's important.
A lot of us have been to chiropractors before, and I got to tell you, before I started coming to you, I thought chiropractors were even. I thought they were the same. You are proof positive that all chiropractors are not created equal.
Thank you.
Okay? A true testament to your profession. Let me say that.
Yes.
Let's also talk about the other side of a claim. I've been in an auto accident before, okay? And I came to you as a chiropractor. But there's also another side. There's another claim against you. 2 sides.
Yes.
One says, hey, you need to take care of this guy. He's been injured. This is the extent of the injuries. This is the loss. Then there's the other side saying, oh, wait a minute, maybe it was pre-existing, maybe this, maybe that. What are the top two categories in defending the claim?
Well, the defense will most commonly come after the plaintiff attorney saying that, well, this person could not have been injured to that event by this causation or this accident, and that means they had a pre-existing type of injury. And it could have been that you had a cervical spine injury in this particular accident, but you may have had something that occurred, say, 3 years ago, a fender bender, where you said you had some neck pain. And they'll say, oh, no, look, that accident happened 3 years ago. That's the reason they're having this pain they claim they have now. And that could be further from the truth. But if you're not a knowledgeable provider, you don't know how to defend against it. How do we defend against it? We acknowledge that that was an injury 3 years ago, but guess what? You recovered from that injury and you were not having any pain 1 year prior, and this accident you had zero pain 1 week before. So 12 months before you were injured now, you had zero pain and you had recovered fully from that accident. That means that the causation, this particular accident, is attributable to what you're experiencing, and that's 100% attributable to your neck pain. And when we document that in our notes, we can help the plaintiff attorney get ammunition to fight against what the defense attorney often says. That's number one. And number two, they'll say it's a low impact injury, but that makes no sense because you are still having these forces transpiring, and they'll talk about delta V. Oh, well, you actually were traveling at 10 miles an hour and you came to a stop, so your delta V is only 10 miles an hour. So you could not have had enough forces to damage your ligaments. Well, that's also false because it's not about the delta V, it's really about the change in velocity over time. You can change that 10 mile per hour, but it can be done instantaneously. And guess what? There's enough force there to damage a ligament. You only need about 5 G's of force to show permanent damage in a ligament. And that is proved by the American Medical Association studies. Now, if you have a quick impact, a jolt or a hit, then that quick movement can easily damage a ligament, and it can be proven scientifically that you have enough force to have a damage of ligament, and our documentation is going to do that by making sure we are, listing 8 injury magnifiers. What are they? Number one, you have been, your defenses are up. When your defenses are up, your joints are locked out, your muscles are tense. You're already at that active range of motion end, and now you're into passive range of motion and joint motion. So that means that the forces have less to go through to get to the ligament and to damage the ligament. Number two, sometimes you're not looking straight ahead, sometimes you're turned. Well, guess what? Now you're talking about the lateral processes of the vertebra being exposed, and most commonly your uncinate processes are the ones that are sheared because you have an impact where the individual may have been turned and looking to the side of the rearview mirror. And then number three, there's weight differential. You could have been hit by a larger vehicle. You're in a smaller vehicle, and then that weight is transferred, also attributing to the ligament damage that occurs. And last but not least, oftentimes on wet surfaces, those particular, there's no resistance, right? So therefore, all the forces are transferred, and it's a greater impact. So a knowledgeable provider will make sure they identify all these 8 factors and they document these 8 factors to help the plaintiff attorney in those type of tactics.
Dr. Carkey, it sounds almost like you're building a case, right? That every step of the way, you're documenting, you're ordering the right mechanisms for not only treatment, but also x-rays, and you're moving to a place to make a presentation. And that presentation is, here's what the client has actually suffered. And here's the extent of the injuries. And here's the extent of the treatment necessary for them to recover. And this is all done through your clinic.
Yes.
How do you build the case?
Okay. Well, number one, you got to make sure that you have the proper treatment protocol. And again, we have our treatment protocol established on the 3 phases of healing. And the 3 phases of healing, again, are going to be the inflammation phase, the repair phase, and the remodel phase. and you're giving specifically therapies that's going to help the patient through that particular phase of healing. So we'll give therapies attributable to the inflammation phase, and we'll change our therapies as we progress through the repair phase and into the remodel phase. So we use a team, a medical team, and I work with my other medical professionals. So I work with medical doctors early on in the inflammation phase, because that's when you need the non-steroidal anti-inflammatories, because you're inflamed. And then primarily in the repair phase, chiropractic is most beneficial. And then when you get to remodel, you need the strength, and you actually need to have that stability. And that's where we employ our physical therapists that we have on our staff. So we make sure that our clients get the best treatment for that particular phase. And we also make sure that we are documenting when they're at the maximum medical improvement. And at that point, we're making sure that we not only are doing the impairment rating and finding out if you have a permanent lax ligament, but then we go into what are your pain and sufferings and how do we describe that? And that's when we go into duties under duress and loss of enjoyment. I mean, your ligaments might be okay if you're going through your regular range of motion, but when you get to the end range of motion and you're overpressure, and now you're placing extra pressure on your joints, that is when you can experience pain at the end of treatment. And we need to quantify that. And we do that in our duties under duress. We're talking about something very simple. You can enjoy normally before the accident, but now after the accident, there's a problem with it. Let's say you want to pick up some laundry, and you bending down, okay, it's fine, but when you load and lift that laundry, that stresses your ligament, and then you have pain. Well, if the provider is not knowledgeable and does not document that, then you will miss that. We make sure our documentation is adequate, and we make sure that we question the patient at the end to provide and to have these things to improve, provide pain and suffering. Not only that, it could be something very, very common. It could be a mother who is bending down to pick up her small child, and now she no longer can enjoy that process of showing love to her child because now she has a permanent damage of a ligament of the lower back, right? That's real to a jury. And you have to understand and document that so that that plaintiff attorney can communicate that and have that special added in.
We've heard the term lowball offer before. People get injured, they have a conversation with the insurance company. Sometimes the insurance company will say, hey, you know what? I can go ahead and cut you a check for this. You don't need an attorney. You don't need to go to a chiropractor. And at the end of it, you find out that was a lowball offer. Okay? What are the 4 award offers possible?
Well, you need to have a knowledgeable attorney as well. And you need to make sure that your provider is providing adequate documentation. In the case that you don't have a knowledgeable attorney and you have a poor documenting provider, you get lowball offers, and this is what happens a lot more than not. That's when you have no documentation to prove these 5 financial drivers, and the attorney is going to accept the first thing that comes across the plate. That's what you do not want. But then you have the second phase where, okay, now you're at a point to where you have some financial drivers and you don't have everything you need to have, and the attorney is not aware of it. Well, you'll get a lowball settlement, right? And then after that, you have it where you have some documentation, right, for the 5 value drivers, and the attorney is arguing the case. And yes, this commonly is something that combats the software that these insurance companies have, and that's called Colossus. And these are basically, they have people behind the screen who basically has a high school education, and they're entering in factors of the case, and they're looking at documentation, entering everything from that documentation into the case. And if it's there, it will make a higher award, but this will be at the level of the adjuster. And that's called a highball offer, where you get to where the adjuster can give you the most that's on their plate. But guess what? If you want to go to policy limits, sometimes you need to bypass that adjuster. And if you have a good, strong case and you have a knowledgeable attorney who's not afraid to go to trial, and you get your limits in your policies. That's where you're at the highball offer, but now you're exceeding that. Now you're at policy limits. So these attorneys, if they know how to build a case and they have a good ammunition coming from their physicians, they can get to that award ceremony. They get to that settlement where it's higher than they need.
There are 4 injury awards supported by specific documentation. What are they?
Well, number one is going to be the impairment rating and the MMI.
Okay.
They have to have that, right? So the impairment rating is very important. You have to treat fully, right? And you have to treat to the point where the person is at the maximum benefit, right? But then you have to have the appropriate diagnoses. You can't have a 1 or 2 diagnoses. You can't just diagnose sprain strain. You have to diagnose to the specificity of the injury and describe the area injured and the ligament that's injured and describe the radiculopathy and how it's affecting that individual. So that's number 2. And then you got to have pain and suffering documented. That's where we have our duties under arrest and our loss of enjoyment. That's showing that they had to go through a certain amount of treatment and they're altering their life permanently. And last but not least, what's often missed most of the time is going to be the prognosis and the need for future care. Right? That's where you're looking at the individual and the treatment and figuring out what treatment got this individual better, how much did they need to get them better, and then how much will they need to have in the future. So you can have a calculation and you'll figure that out, whether or not it's going to be done by a time basis or done by that individual's life expectancy and multiplying that by the frequency that's going to keep them stable for the rest of their life. And this is a very big pot that's missed most of the time. And the knowledgeable attorney can identify this and go after it. But guess what? We're the type of provider that's going to enter that into our notes, and then they'll have that as ammunition going forward. So it's very important to provide that with a good medical team.
Fascinating.
Yes, sir.
Thank you for that science, Doc.
Yes, sir.
All right.
If you want to make sure you are getting the maximum out of these particular clients and these cases, refer them to a knowledgeable doctor who works with a knowledgeable medical team. Call Pain to Wellness Center at 404-699-0966 or Google Dr. Karhi. Again, 404-699-0966. We look forward to helping you. Thank you.